Hello, I'm Dr. Scott Trenhaile. I'd like to take a few moments to introduce you to some of the members of my team to discuss the important aspects about your upcoming surgery. Please feel free to stop the video and take notes so that you can address your concerns prior to your procedure. Thank you for your attention.
Hello, my name is Alyssa and I'm part of Dr. Trenhaile's nursing team. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. If you have any questions or concerns, feel free to contact the office.
Preoperatively, you will have a visit scheduled back in the office prior to your procedure. At this visit, you will watch a preoperative teaching video and all your questions will be answered. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. While each circumstance is unique, patients are typically prescribed postoperative pain medication and non-steroidal anti-inflammatory medications. We will provide you the prescription of your pain medication prior to your surgery to assure timely filling of the medication prior to your surgery. We ask that you please do not take the pain medication until after the completion of your surgery. These medications are for home use only and will not need to be brought with you the day of your surgery. The medications are chosen so that they may be taken together safely as long as you follow the directions on the pill bottles from the pharmacy. It is important that you inform our healthcare team of all medications that you take on a regular basis, including supplements and over-the-counter medications. You may be asked to stop some of these medications prior to your surgery. The day of your surgery, please come to the procedure with a driver that can stay throughout the entirety of your case, as this is an outpatient procedure and you will be going home the same day. Please make sure to wear loose-fitting clothing that was easy to put on after your procedure. If a shoulder procedure is being performed, an oversized button-down shirt is best the day of your surgery, as it will comfortably fit over you and your pillow sling. Surgical patients typically receive general anesthesia in which you will be completely asleep. In addition, it is usually recommended that a regional nerve block also be given in combination to the general anesthetic. During the block, you will be able to breathe on your own, but will be unaware of the block procedure taking place. Generally, I recommend the nerve block as it should provide numbness that typically lasts 12 to 24 hours in duration. This will allow you to start your oral pain medication at home as directed while the block wears off. Starting the oral pain medication as the feeling begins to return allows for a smooth transition between the regional block and the oral medication. Side effects of the block also include the inability to move your extremity to include fingers and toes depending on an upper versus lower extremity block. The inability to move your extremity typically resolves when the feeling returns or possibly sooner. It is very common for patients undergoing upper extremity blocks to experience some pain in the armpit region after surgery, as the nerve block does not provide relief of pain in this area. Basic risks associated with the surgery include but are not limited to things like blood clots, infections, hematoma, failure of the procedure and/or implants, including loosening of the implants and dislocation, nerve damage and fractures, and need to repeat surgery. These risks are low, but are known risks to the procedure. As we get closer to your surgical date, your time for surgery will be released. If your surgery is on a Monday, you will receive a call from our office prior to 3 p.m. on the Friday preceding. For all other surgery dates, you will be notified by 3 p.m. the day before the surgery. Remember, nothing to eat or drink after midnight the night before your surgery. After arthroscopic selective release surgery, you will be placed into a pillow sling. This will need to be worn constantly until the nerve block is worn off in order to protect your shoulder, elbow, and hand. Plan on wearing the sling for approximately 1 week after the surgery, as this is used for comfort only as needed. You will be given written instructions before leaving the facility on the day of your surgery, detailing the limitations that are specific to your procedure. A white absorbent dressing will be placed over your shoulder. This dressing is applied to keep the portals clean during the healing process. Immediately after surgery, the fluid used to distend the shoulder will leak from the portals and then is absorbed into the bandage. Occasionally, the fluid will leak beneath the bandage and a towel can be placed under the arm to soak up the fluid. The bandage should not be removed, but instead reinforced with more bandages or a towel. Occasionally, the fluid that comes out of the shoulder is blood tinged in color. Don't be alarmed, as this is fairly common. If you have any questions or concerns about the amount of drainage that is occurring, please call the number that is provided to you. The absorbent bandage may be completely removed 48 hours after surgery, and you may take a brief shower. The sling is removed and the operative arm is allowed to hang down by your side. The arm is safe as long as you do not attempt to move it in any direction. Bending at the waist to allow your arm to move away from your body using gravity will allow for safe access to the axilla for cleaning. These are called pendulum exercises. At this point in your recovery, I do not recommend any prolonged exposure to water, including bathtubs, swimming pools, or hot tubs. After the shower, you may towel dry the surgical site and apply Band-Aids to all surgical sites. Don't try to clean the operative soap from your shoulder as it has to exfoliate or wear off with time. At your first post-operative visit, we will remove sutures and discuss with you the arthroscopic photos that were taken at the time of your surgery, and also discuss the next steps of your rehabilitation process to include when to initiate physical therapy. Therapy will begin as early as the next day and will consist of therapy sessions 5 times a week for the first 2 weeks and 3 times a week for 3 weeks. You will also be contacted by a representative that will deliver a CPM or a continuous passive motion chair to your house that you will be asked to use for 4 to 6 hours per day. A typical rehabilitation course runs approximately 3 to 4 months. At the conclusion of this, it is important to note that the shoulder remodeling continues over the course of a year after surgery, and it may take a full year to achieve maximal use.